Hi, my name is Laurel Axon Carroll. I'm a licensed acupuncturist and board-certified Chinese herbalist. I'm also a labor support doula, and I'm here today to show some techniques to help induce labor. When I say induce labor, I mean for somebody who's past 40 weeks gestation. So I'm here to show the techniques on Christine. The first point I'm going to use is a point on the hand called large intestine 4. You can locate this point between the thumb and the index finger. I take my thumb and I go right to the top here. And for this point, I'd like to apply steady pressure. So this point is really good for helping the uterus contract. It has a very descending motion, and it's used for a myriad of things when somebody is not pregnant, but in pregnancy, it's very good for descending, helping the baby drop down into the pelvic cavity. It's also really good to use during labor to help ease the sensation of a contraction. So what I do is I kind of apply steady pressure for a while, and then I'll make small circles with my thumb. I tend to go clockwise, but it doesn't really matter if you go counterclockwise. I just tend to go clockwise. If my hand gets tired, I'll take it out, I'll shake it, and I'll come right back and apply steady pressure. When you're having a contraction, it's very good to keep this pressure very steady, especially if somebody's experiencing some pain. So I just hold it real strong and tight. Christine isn't pregnant, so I can apply a little pressure today, and I'm not concerned. But again, please don't do these unless you're post-date, which is post 40 weeks gestation. Okay, the next point we're going to do is on the upper back, and this point is called gallbladder 21. To locate this point, I ask Christine to tip her head forward, and I'll find this cervical spine, this prominence right here. So with one hand, I'll locate the cervical spine, and the other hand, I'm going to find the outside of her shoulder. So when I'm looking for this point, I'm looking for the midway point between these two points. So I'll use my thumb, I'll come right to the middle, or my finger, and it's generally speaking the highest point where the neck, the highest point between the shoulder and the neck, right at the top. So I use my thumb, I can apply steady downward pressure, almost in a stroking manner, going outwards. And for more force, I can actually stand up, and then I have the force of my body, so I'm using a lot more leverage here. And does it feel stronger when I stand up?
Yes.
Okay, and it's also easier for me as well. Lastly, I can use the blade of my hand here to apply some steady downward pressure. And I, again, usually massage in a clockwise, circular manner. Lastly, if I do get tired and I need to put some additional force, I'll use my elbow. So I can stay with the same point and just apply pressure downwards. And this is a lot easier for me. And it can be kind of intense, so I don't use it all the time, but it's really good for helping descending. This is especially good in labor. Okay, so that's gallbladder 21. Very good for getting into labor and while you're in labor. Those are the acupressure points for the hands and the upper back. You can also check out my other videos on ancient current and see other acupressure points for labor induction. These are 3,000-year-old techniques. They're very safe, effective, and they have no side effects. Thanks for watching.